OCA.
Ocala.
Diamonds in the sunset, now your time has come.
5 minutes after 11 o'clock. Thank you for tuning in. We got kind of a theme this one. It was not really a planned theme, and it seems like if I were to identify the theme, it is people who do good things, great things for other people, and often don't get recognized for it. And it sounds like we're going to continue that right now. Lauren Debick is in the studio, and Lauren always brings us some great guests. Lauren is the manager of marketing communications at Ocala Health, and her guest is Leslie Braden, who's the director of MedSurge, is that how I read this? And Cardiac, sounds like something to do with your heart. And this is Certified Nurses Day coming up, right, on this Sunday, and recognition for and by healthcare leaders dedicated to nursing professionalism. I'm reading now, can you tell? Excellence, recognition, and services. Good morning, Leslie, and good morning, Lauren. How are you, ladies?
Good, how are you?
Good. I got to put your microphones on. I always think after the fact. Well, yes, I'm good, and I am good. And you know, last year, 2016, granted, I don't have it in 2017. I had a lot of medical help, and so nurses were kind of a regular part of my life, which I was fine with. You guys are awesome. Ladies are awesome. I think there was one guy in the whole mix, but
We have men too.
yes, I know, but I was mostly ladies. Yes, I prefer ladies, actually. Don't tell anybody. But anyway, thank you, Tantis. Just try to get a laugh.
Every lady's happy.
Every once in a while, I'll get a laugh. It's just my goal, I think. Well, good morning. How are you,
Good.
Leslie?
Good.
Do you how long have you been a nurse?
Almost 30 years.
30 years. Oh my gosh.
Yes.
What was the beginnings for you? How did you decide to become a nurse?
That's a long story. I guess it goes back in my family. My mother's an RN. Both of my grandmothers were
Oh, so you
RNs.
watched it as a little child.
My stepfather is a doctor, and
Wow.
my sister is now an RN.
So when you were a little girl, did you have like Barbie on the operating table? And
I actually have stories that I wrote when I was in kindergarten about being a nurse like my grandmother.
isn't that amazing?
That's fabulous.
Isn't it amazing? You ever look at your old movies and stuff when you were a kid and say, "Oh my gosh, I'm doing now what I did then, what I pretended to do." What were you doing, Lauren, in those movies?
I was writing letters to save the trees, to save the animals.
Oh, really?
I wrote a lot of letters, which makes sense now because I do focus on written and verbal communication. So, yeah.
And it sounds like and helping
And
things
helping
or
things,
people.
helping people.
Yeah, isn't that amazing?
Awesome.
It's funny how, I don't know, I'm not to be too philosophical here, but I think sometimes we're born to be who we are, and we've never been anything different. I've always been this way. I wonder what that says. You know, we had a psychic on one time. You don't mind a little tangent here? And she was like seeing angels around people, and the people were calling in. What do you see? Oh, they're praying for you. You got some illness. We got to help you. And I said, wait a minute. What are you seeing for me? And she said, oh, they're just laughing. They're laughing. That's what I get. I get laughing angels. Well, anyway. So we're recognizing certified nurses this week, right?
Yes.
And you deserve to be recognized. My gosh, the doctors get the credit and you do the work. Is that an uncomfortable thing to say?
Not at all. It's probably the truth.
It is the truth. Well, all right, I'll tell you about my circumstance. I had a tiny little bit of nose cancer, right? Skin cancer on my nose, right? The doctor was awesome. So, I mean, he got rid of it, and I have nothing bad to say about him. But he had no communication skills at all. Everything I learned about what was going on before and after was from nurses. There was 3 of them, remember, in that office?
I do remember.
Yeah, and I would have a question. I remember asking the doctor. I was like this. My nose was open. What going to happen? And then he said, what? Anyway, so then I would ask the nurses, and they would explain it all. So
That's true. That's what we do.
Yeah.
We teach our patients about their healthcare needs and about how to manage their health at home once they leave the healthcare area, and that's the basis of what we do.
And also the social skills.
You've got a nice voice.
Oh, thank you.
You said you were writing? Tell me about your writing. Did you say you were writing when you were little?
Oh, when I was in kindergarten,
Oh,
I have some stories that were saved by my mother, and several of them
So do
said...
you still write? You still write?
No. No,
If you do, you should
for
read-
work.
You should read them. You should read the stories.
Oh, that's sweet. Sweet.
So how do we celebrate and recognize nurses? What do we do?
What Ocala Health is doing is we're going to have a luncheon for the certified nurses.
Okay.
We've also assembled some goodies for them. They'll get a goodie bag, like a tote bag, and I'm probably telling a lot of secrets right now. I think it's a surprise. I think it was a surprise, actually. But yes, that's what we'll be doing to celebrate our certified nurses.
And do they need an invitation? Do they, or is this an invitation right now?
They have received a letter
Okay.
as an invitation.
So if you're a nurse, do I say certified nurse? Is that an important word?
Certified nurse,
Okay.
certified RN.
Then what do they do? Call you and get a show to find out how to go or what to do? Or?
The nurses within Ocala Health System have received a letter as an invitation
Okay.
to
In West
the-
Marion Community Hospital, and Ocala Health, and
Yes.
Ocala Regional.
See, Robin has all the notes. Well, she read them anyway. I have them. I just haven't read them. We do have a whole phone call coming in, and let's take that call. If you put your headsets on, you'll be able to hear the caller. Can you hear me, ladies?
Yes?
Yes.
Okay. Good morning. You're on the air.
Yes, good morning. Since I'm going to say the male invasion in the nursing career, has that helped the wages in that profession?
Did you hear what he said?
I did. Actually, the wages in nursing are very competitive at this time. You can also increase your hourly rate or your compensation by a clinical ladder, which is in more education. You can also get a bachelor's degree or a master's degree, which will increase your marketability and also your compensation. Certification also will increase that.
And that has to happen after being registered? Is that how
You
that works?
you have to have 2 years of experience in
Oh, okay.
in your field of expertise before you can certify.
Does a certified nurse typically work for a hospital, or could a nurse work for a dentist or an eye doctor? Or do you normally see them only in the medical centers?
I'm familiar with the ANCC nursing certifications, and those nurses work in the surgical services. They work med-surg, they work critical care, gerontology, which is elderly patients. So you may see that in the community in a private practice.
And at the nursing homes and assisted living facilities, are there nurses in there, or are they not nurses? The workers in there?
They should, I believe, they have RNs in all
Okay.
of those locations.
Okay.
The RNs can also certify it from those areas.
I just know the one that we advertise is especially wants us to say they have skilled nursing. So
Okay.
I didn't know if that was across the board or that was just some of them. So
Some might not. They might not have certified nurses, or maybe they only have them certain times during the day. The assisted living facilities, whether they're private or government funded.
The decision to certify is an individual decision. It's up to the RN to certify.
do you live here in Ocala?
I do.
And did you grow up here?
No.
No.
I've been here long enough, though, to say I'm probably from here now.
So I'm trying to think the accent. I don't hear one. Do you hear an accent on here? Where are you from?
I grew up in Illinois.
Illinois.
Across the river from St. Louis, a little town called Alton.
Oh, okay.
And I moved to Mississippi when I was in high school and went to
Oh.
college. I went to college in Mississippi and moved here shortly thereafter.
The Midwest mixed with Southern accent.
little bit,
Yeah.
yeah.
Yeah, Robin is from Milwaukee. We had a story this morning. There's a second grade teacher, and she wants to teach the kids about data and making graphs. So she had all the kids ask questions, and we're answering all of them. And the questions are, like one of them, which state do you like better, Illinois or Indiana? The school is in Indiana. Isn't that funny?
That's weird.
I know. They only give you 2 states to pick from. So.
We know a woman that works at an assisted living facility, and she's going for her nursing degree. So she's going here through the School of Nursing. So when they are going for their degree, do they actually work for the hospital while they're going to get their degree, or how does that work?
That's going to be, again, up to the individual who is going to school. Most RNs, or a lot of RNs, could apply while they're in school to be a technician, a nurse tech. We call them CNAs, on the floors in the hospitals.
And then how about the bookwork that they have to do? Do you yourself hold the class, or who does the actual teaching?
Nursing schools, universities.
So what is your day like? You start your day, you clean your hands.
We do a lot of hand washing.
And,
yes,
and your
we
elbows,
do.
yeah.
You too.
So I'm trying to imagine. I'm guessing you walk into work and it could start right away. Like there's no downtime at all.
It never stops.
Really?
Right. It never stops. It's 24 hours a day.
Oh gosh, is it possible to ask you to give us can you tell us your typical day?
Do you want an average RN's day on a med-surg floor?
Yeah, what's it like to be an RN?
Well, usually our assignment would be 4 to 6 patients. We have techs that help us with the actual physical care of the patients, bathing, walking, turning, exercise, eating, that kind of stuff. Just your basic skills.
The word turning, that just sounds so hard. Turning. If it was me, you would need 3 of you. What is the... are the 4 to 6 patients you just referred to, are they the same as you had yesterday? And do you get to know them?
That changes too. It all depends on if those patients are ready to be discharged or go to another level of care somewhere else.
Wow.
We do move a lot of people in and out of the hospital on a daily basis. So those 4 to 6 patients might not be the same. You might have 2 or 3 of them go through one room during your shift.
Wow.
Well, you also have to have communication skills, not just with the patient, but with their families.
Oh, most definitely. Communication is key. And, it's just like being in the service, being in the Army or the Navy. You have to be able to communicate effectively, efficiently, get your point across a certain way, so that everybody knows what you need. I mean, we're advocating for these patients, for their lives. It's serious business.
And you've got to know medicine. I mean, I'm sure you get those questions all the time.
We do. I mean, we're responsible for the quality and the safety of the patient while they're within our care, and that includes every aspect of that. We have to teach them about all of their medications. We have to make sure that those medications are appropriate for the patient. A lot of times second-guessing the doctor and asking, are you sure the patient needs this medication? We have to determine the appropriateness also.
I mean, there's so many skills that I'm just trying to imagine what your life is like. Okay, some lady, I'd be nice, but I'm guessing everybody isn't nice. I'm guessing some people aren't, right? Or they're just not cooperative, right? Or they're not following directions. Hey, did you take your pill?
Usually there's teaching that goes along with that hand in hand. People will most often be cooperative if they know why. If you explain to them what's actually going on and help them make that decision.
Really? Who's harder to work with, men or women?
It's not any different.
No? Really?
No, not at all.
Well, when you say you're the director of med-surg, what does med-surg stand for?
There's different departments in nursing, and depending on the specialty of the patients and the needs of the patients, a med-surg floor is a basic nursing floor. Those are patients who come in with a variety of either medical problems or surgical problems. So that would be med-surg. The cardiac floor, of course, would be a cardiac specialty. Those patients come in having chest pain, maybe arrhythmias, heart rhythms that are...
So do you have to do a lot of CPR?
No, we try not to do that.
Okay.
Okay. Usually we can head that off at the pass and determine that something's going on with the patient before that occurs.
Really? Wow.
Yes.
Do you ever bump into somebody after they're done, they're out in the grocery store and there they are and they're looking good and they remember you and say, oh my gosh, I wouldn't be here now if it wasn't for you. Do you ever get that?
I have occasionally.
We know a few people that have gone in for stents, and that can be a pretty harrowing experience. Do you also comfort them in the beginning, tell them what to expect, and then you're there when they recuperate?
We do, actually. Since I'm the director of the cardiac floor, we receive those patients prior to the procedure and after the procedure, and we do a lot of them. So the nurses are very comfortable in helping the patient understand what the procedure is all about, what they're going to experience, what they're going to feel, what the doctor's going to be doing and saying to them, where they're going to insert the catheter, in their arm or their leg, and what could happen as far as complications, too.
The word stent. Is that new? I mean, I know it's not new, but I mean, you've been doing it 30 years. So were we doing stents 30 years ago?
There's a variety of different types of stents. Most probably recent is
you don't look like you've been doing it 30 years, though.
Thank you.
You went straight from the Barbie doll to the hospital, didn't
I did. Straight from kindergarten to...
So, I'm sorry, I didn't mean to interrupt you. So the stent, what we know today is obviously different than what doctors could do 30 years ago, right?
The cardiac stent is probably the most recent stent that people hear about in the public, but they've been inserting urinary stents for many, many years from a urological specialty perception, yes.
What does that do?
It opens your ureter so that your urine can flow freely, just like the coronary stent goes into an artery and opens it up so that the blood can flow freely.
It's got to be embarrassing. I don't know which I want worse. Or which would be worse. I don't want any of them.
The appearance of nurses has changed over the years, from the stark white outfit and the white shoes to a more casual look. Do you like the more casual look for nurses? Do you suppose? As opposed to the white dress and the white hat and the white shoes.
The scrubs and the colors are much more practical and much more comfortable, of course, than trying to wear white and balance a hat on your head. And I think the last time I wore a hat was when I knocked it off of my head when I was working orthopedics and hit the traction.
Oh my gosh!
But the scrubs are much more practical these days.
Well, patients seem to embrace that more because it's a more casual look, and you seem to be more reachable to the patient as far as asking questions and things, especially children. They like the colorful scrubs.
Yes.
We are recognizing nurses. Certified Nurses Day is the annual day, or for my notes here, thank you, of recognition for and by healthcare leaders dedicated to the nursing profession, excellence, recognition, and service. And Lauren Debick is here. You work with nurses. Are you a nurse, Lauren?
I am not, no.
Are you interested in being a nurse?
I am not. They have a very, very special skill set.
Yeah.
My mom is a nurse. She's an RN. I have the absolute greatest appreciation for what our nurses and physicians do. My skill set is in a different arena, and I can help people and give back to people using my skills.
Sure, absolutely.
But they're wonderful. They deserve all the recognition in the world.
And do you do job shadowing, Leslie? I know some of the high schools in our community, they have a job shadowing program for the seniors. Do you ever have the students come out just to see what it might be like to be a nurse because they're interested in the medical field?
I've not experienced that, and in fact, that would be a question that would probably go to you.
We do work with some local organizations, and if that's something someone wanted more information about, they could contact our HR department and then go through the process there.
So if the Certified Nurses Day is Sunday, March 19th, and you're having a luncheon, just repeat that again, the luncheon?
I believe it's a breakfast, I think.
It is a breakfast.
It is
yes.
a breakfast.
A breakfast with a goodie bag.
And what day is that? Is it Monday?
We have it, I believe, on the 21st and 22nd, so we're going to have a breakfast at each facility for our certified nurses.
Do nurses eat healthy?
Does anybody?
We had the dietitian on last time, so.
I'm trying to eat healthier. I'm okay. We gave up for Lent. We're not Catholic, but I gave up some of the stuff that I'm really bad at, like cheese and bread all the time. Oh, you don't like bread?
I love bread.
Oh, you love bread? See, I can't wait for Lent to be over.
I can't eat much of it.
Oh, you can't? Why?
It's just
You're in good shape, though. I mean, do you use your knowledge of the human body for yourself? Or you're like the mechanic that says, the car's rusting, I'll take care of yours?
Of course, the knowledge is useful in
yourself?
preventive maintenance and care. And
Are you a veteran, by the way?
No.
Okay, I just the way you answered the veterans question earlier, I thought maybe you might have been, or might be.
Oh, since there are nurses who are veterans and they come back from deployment, do they come back into the workforce here and gravitate to the hospitals and use their nursing skills for the hospitals?
I would think so. I know quite a few nurses who are veterans, so they do have that passion, they have that drive, and it would make sense to come back and to get involved with an organization like Ocala Health.
No, Ocala Health is really, really marvelous with the medical profession because you serve the community in all different capacities, and you're very comfortable to be around. And all of the employees that we have met so far within the medical profession seem to be so outgoing that whenever there is something happening in the community, you volunteer your time and your expertise also.
Leslie Braden is Lauren Debick's guest today, and Leslie is the Director of Med Surg and Cardiac at, is it West Marion?
Yes.
West Marion Community Hospital. Just picking your brain again about the profession itself. What is the most challenging part about being a nurse? Is it a patient dying? That would be hard for me.
Probably getting things done to a quality level. There's so many things that are coming at you as a healthcare professional in the workplace that you want to spend that quality time with a patient to make sure that they understand what's going on with them and make sure that they're comfortable managing their issues on their own and at home.
Do you typically get the doctor speaking to you before he goes to or she goes to speak to the patient?
Most times they'll check in with the nurses before they go see the patients to find out what's going on, how are they doing, what kind of progress are they making, and
any questions they might have, maybe in advance, right?
Right.
Yeah.
And that's very insightful about you to talk to the nursing staff about whatever issues they're having at home and on the job, because people have to try to separate that in order to give the best care possible.
Most definitely. You do have to separate that as a professional.
We started out with just recognizing that we had kind of a coincidence this morning. We had a few guests who do jobs. We had a social worker, we had a chiropractor earlier, and veterans in general. We had the veteran show. It is interesting that we have people in our profession who don't get Oscars and don't get accolades. So I think, Lauren, it's awesome that you guys are recognizing nurses the way you are. I think it's something we always need to do. Yeah. So are they going to give you a cruise or anything? What kind of
What do you think, Lauren?
I'll take that back. I'll put it on my agenda.
We could pass around the hat. We could send you somewhere.
They should have a cruise. That's
Will
my
you be
input.
one of the speakers, Leslie? At the luncheon, will you be having guest speakers there?
I won't be speaking. Our Chief Nursing Officer, Sabrina Braun, and Ann Zippor will be speaking at the breakfast.
And what kind of issues do you think that they'll have in their speech that they'll be addressing?
Do they need jokes? Because we
Do you want to send some?
We can help. We'll send some.
I'm sure that they'll express their appreciation for the nurses who have gone above and beyond and certified in their specialties.
And is it hard going from one level of nursing to another and getting your certifications?
Like I said, it takes 2 years of experience in your preferred specialty area to become certified. So there's a lot of time involved.
Mm-hmm.
I have a nurse's joke for you. You want to hear the nurse's joke?
Of course.
I was trying to remember. Okay. So these two nurses were working, and they found a magic lamp. And they rubbed it, and the genie said, "Well, you have 3 wishes." And they said, "Oh, great." The first one rubs the lamp, and she says, "Okay, I want to go to a tropical island." Poof, she's on a tropical island. The second one says, "This is great. I think I'll use it. I'm going to go to a tropical island." Poof, she's on a tropical island. The doctor walks in and finds this lamp. What is this? I wish those 2 nurses would come back.
Oh, no.
It's a horrible joke, I know. Thank you for coming in here. Leslie Braden, thank you for what you've chosen to do with your life, and you make us all better, and you've got a great smile, great voice. You got to record those children's stories.
Yeah, you should.
And Lauren Debick, thank you. Do you want to give out any contact information?
If you are looking for a physician referral, if you would like any additional information about Ocala Health, you can call our health hotline at 1-800-530-1188.
Thank you, ladies.
Thank you.
Thank you.
We'll be right back.
Fox News Radio, I'm Lillian Wu. A day after the president's revised travel ban is blocked by a judge in Hawaii, a second federal court following.
A judge in Maryland has also issued a temporary restraining order against this new immigration executive order. That's a redundant case, though. The one that they're really going to be focusing on is the one in Hawaii.
Fox's John Roberts says that will, in the appeals court, end up in the Ninth Circuit, where the president's lost once already. President Trump out with his proposed budget this morning, military spending